Good evening, friends. My name is Brahmachari Aditya, and thank you for joining this evening. This is the third class in the series of COVID updates that Dr. Amar and myself are doing from Ananda Sangha Pune. And today's emphasis will be on managing the post COVID syndrome. We have so far covered how to best prevent COVID 19 infection. We primarily, you will remember, emphasized on lifestyle, working on our lifestyle. Just to repeat this very important point, that almost 70 to 80% of serious complications of COVID can be prevented through vaccination. The same statistics have been shown now in some studies where over 4 lakh people were studied during COVID 19 and such. Many studies have shown that 70 to 80% of serious complications can also be prevented if our lifestyles are good. So think of adding the benefit of those two. So we shared that in the first class. Then we mentioned a little bit about managing COVID at home. When is the right time? What do we do at home? And when is the right time to perhaps take an online consultation with a doctor or to go to a hospital? And today we are primarily focusing on the post COVID syndrome. The last two times also we covered on cough, how to manage fatigue and shortness of breath for those who are recovering from COVID. These are some of the most common symptoms we are seeing. But let's begin, as we do always, with a chant and with a very brief meditation for a minute or two and prayer to our line of masters. What is this life flowing through my veins? Can it be other than divine? What is this life flowing through my veins? Can it be other than divine? In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one with the infinite home. What is this energy flowing through my form? Can it be other than divine? What is this energy flowing through my form? Can it be other than divine? In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one with the infinite home. What is this consciousness flowing through my brain? Can it be other than divine? What is this consciousness flowing through my brain? Can it be other than divine? In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one with the infinite home. What is this power flowing through my will? Can it be other than divine? What is this power flowing through my will? Can it be other than divine? In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one with the infinite home. What is this life flowing through my veins? Can it be other than divine? What is this energy flowing through my form? Can it be other than divine? What is this consciousness flowing through my brain? Can it be other than divine? What is this power flowing through my will? Can it be other than divine? In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one with the infinite home. In thy light, in thy love, in thy joy, I am one. I am one with the infinite Om. Amen. 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 Let us offer a prayer together. Divine Mother, Heavenly Father, friend, beloved God, great masters of self realization, Jesus Christ, Babaji Krishna, Lahiri Mahashai, Swami Sri Yukteswar Ji, our beloved Guru, Paramhansa Yogananda Ji, beloved Swami Ji, we humbly bow before you all, great masters. We open our hearts, our minds, and our lives to your presence and guidance. Help us understand the teachings of yoga and apply them in our daily lives. Help us serve as instruments for your wisdom and consciousness for all your children. Om Shanti Shanti Shanti. Let us now meditate, friends, for just a minute. Let us rub our hands together now, filling our homes and spaces with the vibration of Om. 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 Om Shanti, Shanti, Shanti. I will now invite Dr. Amar to come and share with us on the theme for today, managing the post COVID syndrome. And also, friends, I'd like to invite your questions on Zoom, where we are right now. And also, we have Blazy who is assisting us through Facebook. So please, you can type in your questions on both these platforms, and Dr. Amar and I would be happy to take them towards the end of today's session, which will go on till 8 o'clock.
Hello, friends. Good evening. And let me begin with some of the slides that I want to show this evening, that how this third part, which is equally important, starting from the preventive aspects to the management at home, that how by simple things we can understand that some people, those who have to battle out the post COVID fallouts, as we say, how we can transcend them. And so I'll show you in a timeline in one of my first slides that how these things come up, what are the major complications and challenges that are going to come. So in this slide, friends, as you can see here, that most of the people which we have talked up till now, that they recover in the 2 week period from the day of first symptom. That is why 14 day is usually considered as the period of isolation. The virus becomes inactive and we are free to come out of our isolation and roam in the society. But then many people after week 2 also, if they keep having these lingering symptoms of many kinds, which are here described, from it could be simple fatigue, or it could be the cough related symptoms, shortness of breath, sometimes it could be having sleep related difficulties, or it could be a stress disorder leading to anxiety and depression, what we call the post covid blues, or it could be sometimes clotting complications like chest pain, or clotting complications in other parts of the body that can lead to stroke or other illnesses. They actually constitute technically what we call the post COVID syndrome. And in many people, sometimes these things have a whole spectrum from milder variety to the severe complications that can come in next 2 weeks, or sometimes in 4 weeks, and can go up to sometimes 6 to 12 weeks also, depending upon what is the baseline health status of the individual. So let's see one by one what is the solution to all these difficulties. Now here in this slide, friends, I am showing you a CT scan. Many you might have understood, you might have come across that people go for an HRCT. Now, how does that HRCT looks like? Now, in this view, you can see that lungs are dominantly the air sacs. They act like balloons, and the air, when we take an X-ray, that always comes black. So right here, you can see in the middle we have heart, and on the two sides, these black areas are actually the lungs. But since this is the normal lung, as you can see here, which is basically the all black. It should come out as black, but all these white spots which are there in the lung, they actually indicate that there is a lot of fluid accumulation, because as a result the lungs become stiff, and because of the stiffness you find that people are not able to breathe properly. They have difficulty of breathing because the air in the lung, which is normally present, has now been replaced by a lot of fluid which has come into them. As a result, the lungs become stiff, and if they become too stiff, then patients work of breathing continues to increase. As a result, they have to be sometimes assisted by a mechanical ventilator. And so this brings you the clarity that what actually happens in the lungs when they have COVID. And as we having when people have an advanced disease, these red arrows here are indicating that how much lungs actually they get affected, they become stiff. And sometimes as the healing also happens, just like when we have an injury over, let's say, in any part of the body, maybe you get a scratch or a small laceration, then the healing happens with fibrosis and scarring. So same way in lungs, when the healing happens with fibrosis and scarring, there is going to be a lot of stiffness which can remain in the lungs for long duration of time. And if it is not adequately addressed, then it can create a lot of troubles with the breathing later on also. So how we can avoid that? Now this is considered, this image which is now present on your screens is called an incentive spirometer. Now this is a wonderful simple tool that can be used to avoid that stiffness in the lungs. Now here you can see that there are these three colored balls, and there is a tube which you have to keep in the mouth. Many of you probably already know it or you have seen it. And when we inhale or suck the air out of the tube, these balls go up, and depending upon how much airflow we generate, depending upon our breath capacity, the number of balls will indicate how optimized is our lung function. If we are able to raise only one ball, that means we have poor lung function, and ideally we should be able to raise the three balls up, and that indicates that we, our lung function is well and healthy. And so this can be a good exercise for people, those who are recovering from COVID. In wards and in hospitals, we give them these incentive spirometers so that they can recover quickly. And in this view, friends, you are seeing that how chest physiotherapy could be helpful to these patients. And chest physiotherapy, when I call, I am talking about these maneuvers which are used, which are done by these cup hands. You can see that how with making a cup of with your hand, you have to tap the chest depending upon which areas are stiff, which areas are having more fluid which is not coming out easily, and then we have to make postural changes in the patient so that patient can drain out all those secretions which are remaining inside the lung. And this is wonderful and sometimes often neglected part of the nursing care, but if done timely and if done adequately during the period of COVID infection and during afterwards also, it can make a lot of difference in recovering the lung function. And in my next slide, actually, this is a very detailed view of the different postures that sometimes nurses use depending upon which part of the lung is badly affected, because some part of the lungs are very poorly uh, poorly, arranged, aligned because of the gravity. So they have to be brought in such a way so that the secretions can drain out. So you don't have to go in the detail of this picture, but this is just to make you understand that this maneuver can be really helpful. So sometimes it is good to talk to your nurses, your physiotherapists, that can these things be helpful. Also, friends, which has been seen, and we know that yogis have been doing these breath practices since ages, which have not only given them vital lung function, good breath capacity, but also it gives them a greater control of their mind and emotions. But very in recent times only, the yoga has started making its way into the conventional medicine. And today, Dr. Aditya will be sharing simple breath practices. He has already shared quite a few in the last few talks also, which can be done easily while sitting in your chair, even while lying down in your bed if you are feeling too weak. And some of these stretching exercises make more room for the lung to expand. It breaks those adhesions which, if they are forming in the lungs, then fibrosis will not come up. And some of these exercises he will be helping us, he will be demonstrating to us today also, which includes full yogic breath, or some of these pranayamas, which would be wonderful to do during the post COVID period. Now, the other important aspect during the post COVID, which is very common, is, and patients come to me, they say that they feel fatigued. And fatigue is a normal part of any convalescence which comes up after the viral illness, especially. And there are many reasons for that, but fatigue can be battled out by many strategies. And here we are talking about six or seven of them in this slide. First of all, friends, what I have understood in my observation, that sometimes people, they start neglecting their exercises once they start recovering from COVID. Now it is very important to keep yourself physically active. That will be one of your best armamentarium, will be which will be the best weapon against the fatigue. That stay active, go outdoors, take adequate rest. Now this is very important. If your body needs rest, especially during the convalescence, give it rest. Maybe your body is asking for 10 hours of sleep, so give it that. Take a short nap in between whenever you feel like resting. Don't overdo or overexert yourself. Save your energy and try to prioritize your work. Sometimes mental fogging can be there. Sometimes you feel that you're not able to concentrate on your task too much or for too long. it would be good to take a break, maybe start doing your work in short spells and ask for help. Maybe your colleague can help with some work, maybe your family can help with some work. Similarly, having a good nourishing diet, and I'm going to talk about diet in a short while, would be very useful tool to battle out the fatigue. And finally, some of these relaxation techniques, now stress management, especially sometimes these anxiety spells or fear or phobias, or sometimes this bad news, what we call the post traumatic stress disorder, PTSD, can actually kind of it can affect our mental efficiency. And there are certain simple yogic strategies which can be used, which includes not only pranayamas but visualization or meditation that Dr. Aditya has been sharing in our previous talks also, which could be useful. So let's now come to the diet part. Now just look at the colors in this picture, friends. Most of the studies have now indicated that whole grain plant based diet is actually the mantra for not only avoiding lifestyle related disorders, not only giving us good recovery, but also in reducing the inflammation. And I think in my last talk also, I highlighted this fact that in COVID also, people are having complications not because of the virus per se, but because of greater inflammation. And this diet, if some people in post COVID period are having lingering inflammation, a plant based diet can actually go a long way in reducing that inflammation. Similarly, yesterday only I read this news article that rather than basing your diet on only a mono cereal, now sometimes I see in North India wheat is very popular, people just eat wheat all the time, or in South India people eat only rice, but they forget that in India we have we have a luxury of these millets which are all diversified. I don't think in any other continent so much of diversity is there in these millets. And sometimes we call them Indian millets, which include ragi, bajra, jowar. Just look at this picture. I mean, this is giving all the kinds of millets we have, and I'm sorry that I don't even know the names of these millets, but many of you, probably those who work in kitchens, you know it. So try to bring variety to your diet. Keep it simple, keep it raw, keep it most of it from fruits and veggies, and keep your night diet, as we talked in the last talk also, simple and light. And many things, as we said, have to be avoided, which aggravate the kapha dosha, and they have to be the similar diet pattern has to be followed during the post COVID convalescence period also. Now, this is a very important subject, friends, because clotting complications. Now, this is actually which is taking a great toll during the post-COVID period, and these clots sometimes can form in heart and can lead to heart attack. If they come in the brain, they can lead to stroke, or if they come in other parts of the body, sometimes they can affect the limbs, or sometimes they can affect the other organ systems. And many times, if it is if we start these steroids and the blood thinners. So I'll request Blazy to show the previous slide here, that the steroids and blood thinners are actually are the saviors, you can say. And sometimes they have to be continued for 4 weeks after the illness also. And in this case, I would say just trust your physician because he knows the best. Because these both these drugs are like double-edged weapons. And in my next slide, as I'm saying, as I'm talking about the steroids, that because they are double-edged swords, if they are given too early or too much, or if they are given for too long, then they can do more harm than benefit. And it has been seen that when we give more steroids, or if we start too early, then that could be the ground for a fungal growth. And these days we are talking about this mucormycosis, and this is actually a very dreaded infection, but it is easily preventable. Because if we do not use the antibiotics too much, because in my one of my preventive COVID sessions, I did talk about that there is a lot of symbiotic relationship as well as a competitive relationship between bacteria and fungi. And all these healthy bacteria, which are trillions of different species which we have in our gut, on our skin, they are actually healthy, and they always suppress any fungal growth from coming up on our skin or anywhere in the body. But if we are using a lot of antibiotics, or if we are not taking good diet or healthy diet, then these variety of bacteria will not be there which are protective. As a result, the fungal growths can happen. So again, I think we are coming back to those basics which are preventive. Yes, as far as heart diseases are concerned, I think this is already this was talked about, that why, if any heart diseases, if anything works best in the heart diseases, is your lifestyle prevention. And this gentleman who you're seeing on the screen, Dr. Dean Ornish, has done pioneering work for last 40 years. He could show almost 40 years back that simple lifestyle measures can reverse even an advanced heart disease. People, those who were being told by the surgeons that they can't even go for a redo surgery, on them also the lifestyle has worked. And similarly, in his recent book Undo It, he has shown whether you are a diabetic, whether you are hypertensive, you can actually reverse it by just changing your lifestyle. And in my next slide, I talk about those four lifestyle keys which can prevent clotting complications. And just look at it, it is very simple. It all just comes down to what you eat, how you respond to the stress, how much activity you do, and how much love and support you have and you give. So, if you have all these four elements that we are talking about, I think that is the way to prevent not only lifestyle related disorders but also staying away from the complications of COVID. Now, this is a very beautiful cartoon, and Dr. Dean Ornish is very fond of showing it all the time. I'm picking it up from his slideshows, and just see what these guys are doing here. They are actually mopping the floor with these mops, but they are just not switching off the tap. I mean, just imagine how long they can continue mopping. And this is exactly what we do when we just give drugs, when we just bank upon the drugs to tackle these illnesses. Because giving drugs and treatment is just like mopping the floor. Whereas when you work on the lifestyle, you actually close the tap. So it's as simple as that. And sometimes a cartoon speaks more than what can be said in words. And these are the few things, friends, because as we see in my last sessions also, if you see, this is the recipe, you can say, for any illness. And all that recipe is right in front of the screen, that if your diet is unhealthy, if you're not moving enough, if your weight is on the high side, smoking and stress, alcohol and high blood pressure. So just imagine, I mean, these are the things. But if we are paying attention, we can just close the tap by changing our lifestyle. And when we can save a lot of money, we can save a lot of time and energy, we can add longevity, we can year quality of life. So, and many things, and not only now, more and more research, friends, has coming which is showing that these things are helpful in all kinds of illnesses, you name it. If it is, even if it is a heart disease or a diabetes or even cancers. Now, this is a wonderful study which I would like you to read about it, that prostate cancer and many other cancers also now they are seeing are actually lifestyle dependent. And finally, friends, now what we call the post-COVID blues. When we talk of this illness, people sometimes, because of less energy, they have to battle out with anxiety and depression and stress. Now, here are certain, we can say, the tools that are available to us, which are here seen in four colored columns. Starting from the lifestyle one, which is in the blue, you can see simply just doing exercises, remaining active can actually help us to deal with the stress also better. And then comes the support from the family. It would be good to actually volunteer work and do some service project, join a community. There is data now to suggest that when people are closely bonded, when they live together, when they care for one another, their depression goes down. Something as simple as tithing. Now, this maybe people have not studied it, but we say in yoga and in many practices, that when we give a portion of our energy, certainly our energy is also affected. And we see in here in the green column that certain behavioral therapies can be done, mindfulness practices, which is nothing but remaining in the present moment, relaxation, doing certain pranayama techniques, is all that is required to come out of anxiety and depression. And very rarely you have to hit this purple column, where we have to talk about drugs. Yes, they may be useful in certain selective category of patients, but more and more studies are now indicating that drugs can be easily avoided if we have to deal with anxiety and depression. And this is another thing, friends, which I like the most, and I think which has helped me quite a lot. Just like Dr. Dean Ornish's book, I was saying, this is another book written by a wonderful neuroscientist, Andrew Newberg. And all of us should read this book, because these are some of those books which are like once in a lifetime opportunities, that how God changes your brain. This gentleman was so inquisitive that he wanted to see what is happening in a yogi's mind. He wanted to do an MRI scan on them, and hundreds of scans were taken. And what he saw was that in the brain of a yogi, the prefrontal cortex, as you see in the next slide, that the part of the brain which is shown here with the green triangle becomes more and more active. And when this part of the brain becomes active, then our fears automatically subside, our anxieties go down, then there is no depression, we start having solutions, we are very calm and compassionate, and it's a win win situation. And this is what he found in the next slide. If you see, the tools which Dr. Aditya has been sharing with us and all the Ananda teachers have been sharing with us, that these tools are absolutely very simple. Just sit upright, do certain exercises, energization exercises that Yogananda gave is a wonderful way of engaging the prefrontal cortex. The breathing techniques, even as simple as uplifting the gaze, will bring a lot of blood to your prefrontal cortex. And visualization has also been seen to reprogram the brain. It has the capacity to make new circuits in our brain, which can come for the better and help us to remain alive and joyful. So finally, friends, I want to conclude this with this last but one slide, where we are talking about the vaccination. Many people ask me, when should we take the vaccination post recovery? Now, this is before answering this question, I want to just ask. I would like you to go on this study which has come very recently in the Lancet, which is a very prestigious journal. Almost 4 million people were studied in this study, which happened in Denmark, and all of them they were having COVID. But later on, they wanted to see that their protection goes up to what point. And what they found in this research was that, especially in people those who are less than 65 years old, they have protection in certain people up to 1 year or more than a year also. And which is actually less for people those who are more than 65-year-old, because of the age related decline in their immune function. And this is also a traditional teaching in the medical schools, that when you recover from any illness, your immunity is more durable and more long term. And now from Indian authorities also, it is a guideline that if you have recovered, you don't have to take a vaccine at least for 6 months. So I think this data is already coming up, because any natural immunity, as it is taught in the medical schools, that is always more durable than any vaccine induced immunity. So I think we should keep in mind this data. So, friends, with that, I would be happy to and welcome any questions if they are there. If not now, we can take them at a later point of time. Also, you could write to us, and we would be very happy to address some of these queries which are related to COVID management, and we'll continue this relationship in future also. Thank you. And now I'd like to invite Dr. Aditya for his exercise session.
Thank you, Dr. Amar. Friends, I'd like to invite you now, in turn, to join me in doing some simple exercises. Please stand up right where you are. And of course, if you've taken your meals already, then be very gentle on yourself. But otherwise, we will do just like we discussed the last few classes, basic exercises, movement for the heart, for proper breathing, for our posture, for our muscles. And again, if you're recovering from COVID, then again, be gentle and do only as much as possible. Okay, there are some questions coming in, and please allow them to come. In the meantime, let us swing our arms, bring your knees up, bring a smile on the face. As you breathe, try to breathe diaphragmatically. Let's try to bring all the components together in this simple practice. As you inhale, the belly should come out. As you exhale, the belly should move in. Try to feel the life force, prana, entering the body, as Yogananda ji explained, from the medulla. Through your willingness and your concentration and awareness, feel that you're sending it to different parts of the body. Now, it may be hard in the beginning to feel that, but with practice, we can learn. And now let's do some affirmations together as we exercise. I'm awake and ready. I'm awake and ready. I'm awake and ready. I'm awake and ready. I'm positive, energetic, enthusiastic. I'm positive, energetic, enthusiastic. I'm positive, energetic, enthusiastic. I am master of my body. I am master of myself. This is a very important exercise. Just an hour ago, I was sharing some of these with about 500 students on another forum, and we were talking about the benefits of neuropsychology on our immunity. This has now been proven through studies. So let's say this one or two more times. I am master of my body. I am master of myself, taking charge of our health. Brush your body cells, repeating these words. Awake, rejoice, my body cells, and feel that rejoicing. Awake, rejoice, my body cells. 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 Be glad, my brain. Be wise and strong. 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 And the final exercise in this series, gently massaging the scalp all over. Repeat these words. Awake, my sleeping children. Wake. Awake, my sleeping children. Wake. Talk to your brain cells. Awaken them all. Invite their participation, their cooperation in what you're trying to do. Change your habits, your diet, exercise, ways of thinking, feeling. One last time. Awake, my sleeping children. Wake, wake, wake. Okay, friends. Let's practice now Dirgh Pranayam, full yogic breath. Rub your hands together. The only contraindication over here are just a few: pregnancy, uncontrolled hypertension, very severe hypertension, or severe backache, and any recent eye surgery, because this involves bending forward. And bend only as much as you comfortably can. But otherwise, it's a very safe practice. Let's take a deep inhalation now as we raise the hands. Breathe out through the mouth. As you come down, go as far as you comfortably can. Inhale as you come up. Exhale as you go down. Do this practice 5 to 6 times. Exhaling tiredness, fatigue. Inhaling joy, enthusiasm, wakefulness. And then bring your hands to the side. Please come in the sitting position now. We'll do some pranayam sitting. Make sure your spine is straight away from the back of the chair. We'll do this practice in the sitting position just for about 7 to 8 minutes because I see some questions are coming in. Sitting up straight, let's close our eyes. And let's listen to these words by Swami Kirananda ji on the wonderful theme of good health. Each time I have read this in the last almost 9 to 10 years, I have found deeper and deeper meaning in these few lines, friends. Good health is more than the state of not being ill. It is a radiant state of inner well being. Physical illnesses may be cured by medicines. No medicine, however, can induce that state of boundless energy which comes when every cell in the body cooperates with the mind willingly, joyfully, in all that it seeks to do. Such radiant well being comes after the mind has been cleared of every shadow of unwillingness, of fear, and of doubt. When one has learned to say yes to life, and when one has learned to love. Please say these words with me aloud. My body cells obey my will. They dance with divine vitality. I am well. I am strong. I am a flowing river of boundless power and energy. In a normal voice now, my body cells obey my will. They dance with divine vitality. I am well. I am strong. I am a flowing river of boundless power and energy. Now only whispering these lines with feeling. My body cells obey my will. They dance with divine vitality. I am well. I am strong. I am a flowing river of boundless power and energy. Now feeling more deeply, almost experiencing these words as we say them only in the mind. This is to change our subconscious habit patterns. My body cells obey my will. They dance with divine vitality. I am well. I am strong. I am a flowing river of boundless power and energy. And one last repetition to make this a super conscious living reality going forward. My body cells obey my will. They dance with divine vitality. I am well. I am strong. I am a flowing river of boundless power and energy. Let us add this prayer to strengthen our affirmation. O mighty source of all that is right and good, help me to see my strength as an expression of thy infinite power. Let me banish the darkness of disease. It is forever foreign to thy light. And let's close our eyes, friends, for a brief moment, feeling the living reality of the words we repeated in this affirmation, of our resolve, our aspirations, ultimately our higher expression. And let's live in this reality as we meditate for 2 minutes, as we sit in silence for 2 minutes. Om Shanti, Shanti, Shanti. Please open your eyes now, friends. And I would like to again invite Dr. Amar over here. We have some questions. We have 3 questions over here, friends. No, you can come here, Amar. And then actually 4. And if more come, we will let you know. No, no, yeah, I'll be here.
So Blazy is sending us on the phone also.
Sure. And the first one says, few friends and relatives are complaining of severe throat ache, fatigue after recovering from COVID almost a month ago. They got negative report 10 days back. They are scared of going back to steroids or antibiotics. What can they do at home?
So yeah, if they are negative with the COVID report, that means they don't have any active virus in them. And but if they are still having sore throat, then they can definitely do some gargling, and they can. I think Dr. Aditya also mentioned about these sun gargles, and I received a testimonial a few days back. Then this man was also facing the same trouble, and he said that by doing sun gargles, he got almost immediate relief in just a matter of few days. So that can also be tried. It's also the diet has a lot to do with the sore throat, which we sometimes have this lingering sore throat which continues for days together, because the diet has to be alkaline, which we have talked and highlighted this fact many number of times. And stick to this alkaline diet for at least 2 weeks post COVID, and do maybe a little fasting. That could also be helpful. But please don't think about taking steroids, because they will not help it. Even if your symptoms goes down, but it may actually create complications at a later point. And as I talked, that steroids are those double-edged weapon kind of drugs that they may actually lead to taking the immunity down, and then fungal infections and so many other complications can come.
I'll just add that, friends, this is the third class in a series on Ananda Sangha India Facebook page, Ananda Pune YouTube page. You can also find the previous two recordings. And in the first one, we had covered the post COVID symptom of cough and throat ache, difficulty that are related to the throat area. And there are certain exercises Yogananda ji recommended. We will once again post in this chat section the link to his book, How to Achieve Glowing Health and Vitality. That is where I had picked up the sun gargling and certain exercises for the throat. Very remarkable. So that answers your question. There is another one. Remdesivir was used at large scale. Why now is it being banned? I think Amar can answer this very briefly because it's
Yeah.
one of many controversial. See, we are trying different things,
Mm.
and many treatments are being discarded as we speak. New ones are being tried. But I'll let Amar
Yeah,
take
so
that one.
remdesivir, friends, was actually one of those drugs which, in right in the beginning, WHO said that it is not helping much. And if you see, there was a very limited data where the usefulness of this drug was found, and that too in only reducing the hospital stay of a very small percentage of patients where they were on less oxygen. Neither it was helping the severe COVID patients, nor it was helping the milder ones. So, and I would like you to read this article because Dr. B.M. Hegde often talks about it in great detail that much of the research these days are actually pharma funded. And so there is always some degree of conflict of interest. And at the same time, this drug was actually tested in Ebola, and it was found to be not useful. But later on, there was an article which said that remdesivir is a drug in search of a disease. And I would like you to read that article. And in fact, one of the best ways to battle this kind of kind of things which are coming up in society, whether it is medical fraternity or it is a educational community or politics, there is a lot of churning which is happening, and public awareness, I would see, is one of the ways to battle these things out. So yes, that's a great question, but I would say stay aware and awake. Just don't take anything on the face value. Everything has to be taken with a pinch of salt, and awareness is actually the best weapon.
There's another very nice question, Amar, which you should take over here. Sorry.
Here are the
Oh, you
questions.
seen
She's
them
coming.
about
Yes.
vaccines and
What kind of
steroids?
blood thinners
Blood
and
thinners,
steroids?
yeah.
Yeah.
Why don't you take that?
So the question is that what kind of blood thinners and steroids are required, and is there any investigation to know when to start these medications for post-COVID patients in recovery phase? So there are many kinds of steroids and blood thinners. Some blood thinners are especially useful for the arterial clots. Some are useful for the venous clots. Some are useful for both kinds of clots. And the timing, as well as the timing when to start these drugs, and also in what dosage they have to be started and for how long they have to be continued, these three things are, I think, the which are the crux of the matter. And Dr. B.M. Hegde actually talks about it in great detail because he knows the best. And they should not be fiddled with on their own. It would be rather dangerous to start these drugs if they are started on their own, and they might be creating a lot of trouble. But yes, there are certain tests, as you asked, which can help us to understand what is the how much is the inflammation, or what is the inflammatory burden in the of the disease in the body, because then these clotting complications have a higher risk to happen. And this is one of the tests I have talked about is the CRP test, C reactive protein, or a D dimer is another test which is actually also suggestive
And
of
without going in
clotting.
detail, Amar,
Yeah.
if I would ask, is
Mhm.
this something one could also understand or get online? Because
Mhm.
one of the students was saying they're afraid to go back to medicines and
Mhm.
hospital. Nobody wants to go to hospital.
Yeah.
So they could have a local consultation, or Dr.
Mhm.
Amar also takes consultations on this
No, no,
matter
I would say the person who has treated them
so
for
far.
so far, he would be the best person to go back to. And we are always happy to offer any kind of help and support. But at the same time, these drugs, since they are double-edged weapons, so please don't fiddle with them on your own. It would be good to have a expert
Absolutely.
consultation. So, how many days after recovering from COVID should I get a vaccine? And also, I think this I have already answered in my talk. So, alkaline food to be adopted. Thank you. Any specific food, fruits to be avoided? So, I think this also has been talked about because I did say that since it is a kapha dosha, going by the Ayurveda, we have to avoid those foodstuffs which aggravate the kapha dosha.
Well, here's a very good testimonial. Sir, after becoming COVID, recovering from COVID, I have become more energetic, somebody's writing, which often is the case. If we take it with the positive attitude, some of the biggest tests of our life, they do teach us something. Today, I met another friend who is recovering from COVID. I said, "You're looking brighter than before." And one of the reasons is that a test comes, but if you take it, like I said, with a positive attitude, it helps us better. Here's another question that has come about alkaline food, which foods to be avoided. But particularly, I think Amar mentioned, but bananas and milk, those kind of foods which lead to more mucus production should be avoided, friends. Air conditioning also spreads COVID. Is it true? Amar, you want to take that?
So yeah, I think in one of my first talks also we did talk about the micro hairs which are there in our respiratory system, and we call them the cilia, the microcilia, which are in our windpipe. They are trying to trap all these dust particles in the mucus layer, and they always beat in a fashion that they always come from below upwards. So this is their beating fashion, so that whatever dust particle or germs are going inside, they're trying to bring it out into the nostril, and sometimes through a cough or a sneeze they are expelled out. But if you see, for them to work optimally, the environment inside the windpipe should be warm and humid. So in those conditions, our lung functions are optimally the best. But what happens in an air conditioning is that if you stay for too long, it will lead to dryness that you might have experienced in your airways. And because of that dryness and coolness, which is the exact opposite condition in which your lung functions are working the best, your clearance mechanisms will be not performing well. And as a result, you have a greater chance of trapping those viruses and leading to sore throat and infections. So yes, in these air conditioners are they were never good, and they are not good now also for any kind of respiratory infection. And moreover, there is a lot of cross infection. If you're sitting in the same environment, there is a lot of recirculated air which we are inhaling.
Here comes another question. If CRPF is 10 after recovering from COVID, what should be done? Well, how many days?
So in certain conditions, it may, if it was, let's say, very high in the beginning, let's say it was more than 50, and it is now coming to slowly coming down to a level where it is still more than 10, then if it is declining, then there is not much of a concern. But if it is jumping up from a baseline of low value, then certainly it does indicate that inflammation is taking a turn
Says
for the worse.
after 1 month.
After 1 month.
That's the reading.
Yeah, but then we should have a reading of the immediate value also. What was the value during the illness and during the first 5 days and immediately afterwards? Because we have to see whether it is rising. Sometimes when people have very high values in the beginning, and then after 1 month it is still 10 or little above 10, then it is not of a concern. But if it was less earlier, and over a period of month it is showing a rising trend, then it shows that inflammation is going high. And then again, we will come back to the same things which we have shared, which includes lifestyle, diet, exercise, meditation, and drugs, which will be helpful. But again, drugs is a part which I will leave to the physician who is the treating person. But all those other non drug measures can be done on your own to reduce the inflammation. CRP is just an indicator of inflammation.
Okay. Well, friends, that brings us to a close. And please do send in your questions if you have more of them. We will also keep you posted about these COVID updates as they come. And in high probability, we'll have another follow up session. We started this 3 weeks ago, but of course, we are happy to continue as long as there is a need. But thank you for your support. Thank you for your questions and for sharing this further with many other people. Like Dr. Amar and I, we did two other workshops today for different batches and students. It is just so heartening again and again to get to know the entire spectrum of what is available in front of us. Yes, the medicines, more research on vaccination, but at the same time, much of what we already know but may not have found the time earlier to apply in terms of our lifestyle. And I think it's time for us all to move towards this integrated health approach where we do our part, the doctors and scientists and researchers are doing their part, and as Yogananda used to say, God and gurus do their part. And with this wonderful understanding of the disease, our own health, and other sometimes even spiritual matters, I think we can finally, that's the best one can do. That is all is expected of us. So we want to thank you that how this class series has sharing with all of you in the weeks to come. God bless you and see you again.
Thank you.